Let's talk about how you can get an Ecfmg certificate in the US. What's up, guys? My name is Dr. Safo Asante. I'm the successful IMG. Successful because I'm matched. I'm here so that you can as well. In this video, I'm going to talk about how you can get an Ecfmg certificate for the match of 2022. The video is going to be divided into a quick blurb about the importance of getting an Ecfmg certificate, the requirements for getting an Ecfmg certificate, and then I'm going to talk about the different pathways that they have in place at the moment. As always, for those of you that are not aware, I mentor people to help them match into residency. I also help you with interviews. If you are already good in all the other areas and you just need help with interviews, I help people that have had a difficult time matching with interviews so that they can match into their dream specialty, so they can match into residency. If you're interested, my contact information is down below. Make sure you contact me. All right, moving right along with the video. You must pardon me. I'm not going to be looking at the camera because I'm on the road. So, what's the importance of the Ecfmg certificate? The Ecfmg certificate is given by Ecfmg, and basically this certificate says that you are competent enough to practice medicine in the US based on specific standards that certify certain things in the US. What are the requirements that you need to fulfill when you apply for the Ecfmg certificate? You have to prove that you have clinical knowledge. You have to prove that you have clinical skills and communication skills to practice in the US, and that's what they care about. Before the pandemic, the COVID-19 pandemic, which affected the match of 2021, the way that we used to certify the clinical knowledge portion is a USMLE Step 1, USMLE Step 2 CK. So when you pass those exams, that you've shown that you have the clinical knowledge. That's still being used at the moment. The thing that has changed is how we show proof that we have the clinical skills, that we have the communication skills to practice medicine in the US. Before the match of 2021, before the COVID-19 pandemic was at its high, the way that this thing was tested was through the Step 2 clinical skills exam. It's an in-person exam where you have patient encounters, where you go through like the history, you do a physical, then you come outside and you type a note. You do that for about 12 to 15 patients. I don't quite remember exactly. And everything is timed. And basically that tests your English speaking skills, that tests your ability to perform a clinical encounter. So that was before the COVID-19 pandemic. After the high of the COVID-19 pandemic, for the match of 2021, they had to scrap that because they wanted people to avoid being in contact with each other. So the Step 2 CS was scrapped. And in its place, they put two things. One, you had to pass an English exam called the OET, where I think you do a writing portion, you do a reading portion. It's a little bit more. I'm not too well versed with that, but you had to pass that English exam. And then the second thing that you had to do is you had to apply through one of 5 pathways. And once you did both of those things, you can get an Ecfmg certificate. For the match of 2022, it's been changed to some extent. They've added a pathway 6 to the 5 pathways that were there before. I'm gonna go over all the pathways in general. And if you need a little bit more information, you can always look further into it on the Ecfmg website. I'll put the link down below for you guys. Now, let's go into the different pathways. Pathway number 1. Anybody that's applying to pathway number 1 needs to fulfill these requirements. They need to have a license from their medical school country to practice medicine without supervision. So anybody that fits that criteria applies to pathway number 1. Pathway number 2 are for people that do not have a medical license to practice without supervision. However, they've finished their medical school and they've passed a clinical standardized exam in that country, not the US, in that country, that tests their clinical skills. Pathway number 3 to pathway number 5 are basically medical students that attend medical schools that have been accredited by specific bodies. So I think pathway number 3 is medical schools that have been accredited by the World Federation of Medical Education, I think, the Ecfmg. I might be saying the acronym wrong, but the concept is basically pathways 3 to 5 are medical schools that are accredited by different bodies. So you have to check to see which body accredits your medical school, and then you decide whether it's going to be pathway 3 that you apply to, pathway 4 that you apply to, pathway 5 that you apply to. Then pathway 6 is for people that don't meet any of the other criteria, people that failed their step 2 CS. For these people in pathway 6, you have to get tested by a US practicing physician that's going to attest to your skills. Now, who those US practicing physicians are, I don't know, but I'm sure they will release information soon about who those US practicing physicians are. So there you have it. Those are the 6 pathways that you have to apply to. So if you're trying to get your US MLE, if you're trying to get your Ecfmg certificate so that you can go to residency, so that you can eventually practice in the US, you have to have passed your USMLE Step 1, USMLE Step 2 CK, so that you can show that you have the clinical knowledge. You have to have passed your OET and also apply through one of the 6 pathways that I mentioned, so that you can basically show that you have the communication skills and the clinical skills to practice medicine in the US. If you have any questions, put the questions down below in the comment section. If you would like to contact me about my mentorship program, about my interview program, and my contact information is down below. Also add me on Instagram, DM me on Instagram, that's fine. You can also add me on Facebook. All my information is down below. All right, guys, I wish you guys the best of luck. I need to focus on getting to work.